Baseball is known as America's favorite pastime, and there's no better sight than a home run. In order to hit a home run, the batter must build his swing from the ground up. You may think that the hitter's power is located in his upper body, but the best hitters of all time use their legs to generate the strength to knock a ball out of the park. In this video, I will be showing you a proper baseball swing and the joints and muscles generating the power. There are 3 stages of lower body swing technique: the loading stage, the power stage, and the follow-through. The loading stage is seen as raising the front leg off the ground and then setting it directly down. There is flexion at the acetabulofemoral and tibiofemoral joints. The acetabulofemoral joint is flexed by the iliacus and psoas major, while the tibiofemoral joint is flexed by the hamstrings, biceps femoris, semitendinosus, and semimembranosus. When the leg is placed back on the ground, there is extension at the hip and knee. Eccentric action of the rectus femoris and vastus intermedius, lateralis, and medialis muscles act on the hip, while eccentric action of the biceps femoris, semitendinosus, and semimembranosus act on the knee to control extension back to the ground. The next stage is power. In this stage, the pelvis transversely rotates to the left by unilateral flexion of the right gluteus maximus. Moving down the body, the right acetabulofemoral joint internally rotates by the flexion of the right gluteus minimus. At the tibiofemoral joint, the knee flexes by contraction of the biceps femoris, semitendinosus, and semimembranosus muscles. Finally, the right talocrural joint dorsiflexes by concentric action of the tibialis anterior, extensor hallucis longus, and extensor digitorum longus. The final stage is the follow-through. In this stage, the pelvis continues to rotate transversely to the left, and the right hip, knee, and ankle internally rotate, flex, and dorsiflex, respectively, until they hit an angle of about 90 degrees from the starting point. The follow-through focuses mostly on the left or lead leg. At the acetabulofemoral joint, there is external rotation by the left gluteus maximus and sartorius acting ipsilaterally. At the tibiofemoral joint, the left knee extends by concentric action of the rectus femoris, and the plantar flexion occurs at the talocrural joint by concentric flexion of the gastrocnemius. There are a few major injuries that are common to baseball players. Because of the intense and repetitive hip rotation, some baseball players can develop snapping hip syndrome. This injury is due to strength and flexibility imbalances from overtraining. It manifests as an audible and painful snap of the iliotibial band, tensor fasciae latae, and gluteus medius tendons rolling over the greater trochanter of the femur. Another common injury is hamstring strains. This injury is caused by excessive stretching of the hamstrings when extending the hip. There are 3 levels of strains. A grade 1 is a mild and heals within a few days. Grade 2 is usually a partial tear and takes longer to heal, while a grade 3 is a severe and complete tear of the muscle which takes months to heal. The hamstring strains usually occur near the distal end of the femur as the tendons of the semitendinosus, semimembranosus, and biceps femoris attach to the proximal head of the tibia. The final common injury to baseball players is ankle sprains. Excessive inversion or eversion occurs often because players are constantly making quick power motions to change direction or react to situations. In this case, rotating incorrectly during a swing can cause an ankle sprain. Excessive inversion is most common and damages the talofibular and calcaneofibular ligaments, which are located on the lateral side of the talocrural joint. The combination of muscle contractions at the acetabulofemoral, tibiofemoral, and talocrural joints creates a lot of forward momentum. This momentum is used to explode on the baseball and knock it out of the park.